Okay, Assalamu alaikum everyone. This is going to be a very short video. We have just started with the CLSI guidelines, which are the latest guidelines for antimicrobial testing and susceptibility reporting. So I think my camera is not a bit stable, but I'll try to, go through the details. So these organisms, I've just picked up the first one. We're going to start with gram-negative rods, and the ones they really want to test on the exams, whatever exam you're taking in medical microbiology, there are certain favorites of the examiners, and STENOTROPHOMONAS and Burkholderia are both of these organisms, right? So we are just going to see if what are the drugs that should be reported in the basically if you're reporting STENOTROPHOMONAS. So the new CLSI guidelines have given 4 tiers to report different antimicrobials, right? So in I'm sure you have all gone through the tiers and the description, but I'll still read out that which tier, which antibiotic belongs to which tier and why, right? So tier 1 antibiotics are those that are appropriate for routine primary testing and reporting. These are the antibiotics that you must and should report in all situations in the case of STENOTROPHOMONAS maltophilia, right? So this is tier 1. This has to be reported in all the cases of steno. So there are only 3 drugs which come under the heading of tier 1 for STENOTROPHOMONAS. So I'm going to further upload a video which is going to compare STENOTROPHOMONAS and Burkholderia with one another, and then we'll see. That would be much easier for memorizing this whole thing. So there are only 3 antibiotics which are covered in the STENOTROPHOMONAS AST testing and reporting. So these are levofloxacin, minocycline, and trimethoprim sulfamethoxazole. So this is the primary testing panel. The tier 2 is also the primary testing panel, right? But you can see that in STENOTROPHOMONAS, the tier 2 does not contain any antibiotics, right? So tier 3, which are the tier 3 antimicrobials. So these are those which are appropriate for routine primary testing in institutions that serve patients at high risk for multi-drug resistance, but also should only be reported following cascade reporting rules. So these are the antibiotics that you're supposed to report only if the organism is a multi-drug resistant organism. So if you have all your 3 first antibiotics are resistant, then you can report cefiderocol in the case of STENOTROPHOMONAS. In the case of tier 4, what are the tier 4 antimicrobials? These are those which are going to warrant testing and reporting by clinician request if antimicrobial agents and other tiers are not optimal because of various factors, right? So basically, if the first 3 tiers are resistant, or you cannot give them because of some other reason, then you need to test and report ceftazidime, which is a cephalosporin. What additional thing I would like to add is basically in the footnote is basically the ceftazidime cannot be tested by disk diffusion. I'm going to repeat it again, that ceftazidime cannot be reported by disk diffusion. You need an MIC testing method, otherwise the disk diffusion testing is unreliable for this kind of a thing. So this was a very short video. The next time I'm going to upload a video which is going to compare and contrast the AST between STENOTROPHOMONAS and Burkholderia. Thank you very much.